Welcome to China Truths. In this episode, we will bring you the following stories. US CDC monitoring HMPV outbreak in China. Shanghai banned live poultry trade for 3 years. Now, let's dive into the details. China Truths. US CDC monitoring HMPV outbreak in China. The U.S. Centers for Disease Control and Prevention, CDC, said it is monitoring an outbreak of human metapneumovirus, HMPV, in China but does not believe the disease is currently a concern for the United States. In December, Chinese hospitals saw an increase in respiratory diseases, including influenza and HMPV, which put neighboring countries on alert. In a statement on Monday, a CDC spokesperson said the center is aware of reported increases of HMPV in China and is in regular contact with international partners and monitoring reports of increased disease. The reports are not currently a cause for concern in the United States, the spokesperson said. They added that the CDC is getting weekly reports from participating U.S. laboratories, and surveillance systems are expected to rapidly detect any increase in HMPV cases in the United States. HMPV, a lesser-known common winter virus, was discovered in 2001. According to the CDC, the virus can cause upper and lower respiratory disease in people of all ages, with young children, the elderly, and people with weakened immune systems being particularly vulnerable. As with other respiratory diseases, HMPV infections can cause symptoms including cough, fever, stuffy nose, and shortness of breath. In some cases, it may progress to bronchitis or pneumonia. There is currently no vaccine for HMPV. According to data from the CDC's National Respiratory and Enteric Virus Surveillance System, 1.94% of HMPV test results in the United States were positive in the last week of 2024. In the past 3 years, the rate fluctuated between around 0.21 to 10.99%. During the COVID-19 pandemic, it dropped as low as 0.02%. According to a report published on December 27 by state-owned China Central Television, CCTV, data from China's CDC showed increases in acute respiratory diseases, including influenza, Mycoplasma pneumoniae, Chlamydia pneumoniae, and infections of rhinovirus, human respiratory syncytial virus, and HMPV. One person may be infected with multiple viruses. Among these, there was a surge of HMPV infections among children aged 14 and under, CCTV said. On social media, parents from Wuhan, ground zero of the COVID-19 pandemic, said that many schoolchildren have taken ill. On January 2, a parent from Wuchang district in Wuhan said that many students at her child's school were infected with influenza viruses. 3 third-grade classes had to suspend class, and her child's 4th-grade class was also affected, with over 30 students taking sick leave before the New Year holiday. Meanwhile, unverified posts appear to show packed hospitals with masked patients, scenes akin to those during the COVID-19 pandemic, leading to some fears of another epidemic. Authorities in Hong Kong, Macau, and neighboring Taiwan, Vietnam, Malaysia, India, and Japan are said to be monitoring the situation. Dr. Shan Lin, microbiologist and member of the Committee on the Present Danger, China, said there is no need to panic over HMPV, but the Chinese government's lack of transparency remains an issue. The problem is that the Chinese government didn't provide systematic data for the outside world to understand what's the real situation, he said. Lin said increased hospitalizations related to respiratory diseases in China could be connected to weakened immune systems in the Chinese population as a result of COVID-19 infections. He added that the world should pay close attention to mutations of bird flu in China to watch out for new strains that could be more infectious to humans. Shanghai banned live poultry trade for 3 years. At the beginning of the new year, Shanghai announced a ban on live poultry trading for 3 years. A report from China's Center for Disease Control and Prevention (CDC) showed that there were 23 cases of human infection with 5 subtypes of avian influenza in China. At the same time, the CDC also stated that this wave of epidemics in mainland China is mainly influenza A, but did not mention severe cases and deaths. A public document on the website of the Shanghai Commerce Commission showed that Shanghai would implement the ban on live poultry trading from January 1, 2025. The document was signed on December 20, 2024, and was publicly published on December 23. The document states that in view of public health risks, live poultry trading will be suspended citywide from January 1, 2025 to December 31, 2027. In case of special circumstances, a separate announcement will be made. All live poultry from other provinces and cities are not allowed to enter this city for trading directly, except for being transported to this city's live poultry slaughterhouse for centralized slaughtering. Relevant departments have strengthened supervision of live poultry trade in accordance with their respective responsibilities and encouraged citizens to report. The document concludes by emphasizing, this announcement will come into effect on January 1, 2025 and will be valid for 3 years. There is currently a massive virus outbreak across the country. The document banning live poultry trade in Shanghai for 3 years was released against this background. According to the Risk Assessment of Public Health Emergencies of Attention in China in December 2024 published by China CDC, in November 2024, 2 cases of human infection with H9N2 avian influenza were found in China, one from the Guangxi Zhuang Autonomous Region and the other from Guizhou Province. Both were children and had a history of suspected live poultry-related exposure before the onset of illness. As of November 30 last year, China had reported a total of 23 cases of human infection with 5 subtypes of avian influenza, including 17 cases of H9N2 avian influenza, 3 cases of H5N6 avian influenza, 1 case of H10N3 avian influenza, and 1 case of H10N5 avian influenza and H3N2 seasonal influenza co-infection. Avian influenza is a disease caused by influenza A virus. It mainly affects birds, but some subtypes, such as H5N1 and H9N2, can also infect humans. Humans usually become infected through contact with live birds carrying avian influenza viruses. Humans can also become infected through contact with sick people. Cases of H5N1 avian influenza are also on the rise in the United States. Health authorities in Louisiana, USA, confirmed on January 6 that a patient infected with H5N1 avian influenza died after being hospitalized. This is the first reported death from avian influenza in the United States this year. The United States first reported human avian influenza in April 2024. As of January 3 this year, 66 people in the United States have been infected with avian influenza, most of whom are farm workers. For the current wave of epidemics in China, China's CDC said that more than 99% of them were influenza A, H1N1. Wang Qingdong, a pediatrician at Shanghai Xinhua Hospital, disclosed in a video on January 5 that 5 children have been admitted to the emergency room because of influenza A. Some have been put on ventilators, some have not even been rescued, and some have been complicated with severe encephalitis. Influenza A has caused many deadly pandemics in history. In 1918, about 500 million people worldwide were infected, resulting in at least 50 million deaths. The most recent pandemic was in 2009, when more than 600,000 people died worldwide, more than 80% of whom were people under the age of 65. People in China are also paying attention to the epidemic on the internet. People in Beijing, Shanghai, and other places have reported that after repeated tests, they don't know what kind of virus this wave is, neither influenza A, nor influenza B, nor the new coronavirus, but only that it is a virus infection. Although China's government has not officially announced the number of severe cases and deaths in this wave of the epidemic, there are many posts on the internet of people mourning their deceased children and exchanging information about severe cases. Many children died in the current epidemic, most of whom died of encephalitis and febrile convulsions caused by influenza virus.